I'm just so grateful to have a chance to meet you, because this project and these trainings are something that are very close to my heart, and something that I really appreciate is just shared with the world. Women coming together in this way and just honoring the wholeness of our experience that is so multifaceted, and there's so much to it, and how much we learn when we come together. It's so beautiful. And as Sharada said, so I've been joining the trainings and sharing from a yoga therapy and physiotherapeutic perspective around pelvic health, or health in the female body. So for this session now, I thought of giving you a few different aspects of how we can approach pelvic health as I kind of see it today. Probably will change. So there's different, I guess, approaches that we can take depending on our needs and what's actually going on in the pelvic floor, in our whole pelvic area, in the low back, in our womb, in our yoni. So just different ways for different needs at different days. I hope you can pick out some favorites from this practice. So it would be a quite calm but thorough investigation, I hope. We work with the pelvic floor, just focusing on the pelvic floor itself, we're missing out on so much, because the core, as seen in the human form in dissection, they found that actually it starts from the feet and it runs up the inside of the legs, deep in the deepest part of your calf muscle, coming up into these big muscles on the inside of your groin. Then there's a connection to the pelvic floor and also to the iliopsoas muscles, so the hip flexor or spinal stabilizers. And from there, they come up to the diaphragm. And from the diaphragm, actually traveling up to deep neck muscles on the front of the neck. And of course, the jaw muscles and the temporal muscles. So your core or your pelvic floor is, it's a full body experience. It's not just this area here. So some of the practices we might get to today will address the wholeness of that. So I hope that you have some things at home. So I prepared quite a lot of props today, but I will give you options also. So what I have is 2 of these balls. These are quite soft and yielding, but still firm in the core type of therapy balls. You can also have tennis balls or something like that. So we'll use them for self-massage of the fascia. And then I also have a belt. This could also be a scarf or whatever type of belt you have at home. This is a special yoga belt. And I have a few pillows, some small pillows, and 2 larger yoga bolsters and 2 blankets. And that's just luxury because I have them. But at home you can try to find things that are equivalent and you might use them in the practice. So as I said, then we will begin with the feet, because many of us have maybe weak or overburdened feet, and we walk in shoes and we walk on pavement and flat floors, and this is really very difficult for our feet, because in the architecture, how they are created is to really navigate more uneven surfaces, and to not have so much support, because if we support one part of the body too much, it will become weaker, of course. So one way of giving ourselves some more heightened awareness in this line, it's called a deep front line in the anatomy trains model, is by just massaging the feet. So if you take 2 balls, and you can, or actually you just need one, otherwise you will fall. So one way of doing this, I'm gonna stand on my knees, but feel free to stand up. This is just some still in view for you all. So you take the ball and you start to rub it underneath your foot. And just begin to feel the ball at first. So giving yourself a sense of, okay, this is actually my foot, and how does it feel to put some pressure on it? And you might notice that parts feel more tense than others. There might be points that are tender. So I would advise you to try to find like the top of your foot, so the triangle here, and place the ball so that you can roll crossways like that over. And that would look something like this. You start to cross from side to side. And you can start to lean into the ball. And the more weight you put on it, of course, the deeper the massage will be. And the most sensitive part of the feet for most of us, where we want to have more of the proprioceptive awareness, so the sense of here's my foot actually, is the inner line of the foot. And you go across. And at the front of the heel, you might feel, okay, here's actually a tender spot. It's very common, especially if we have a little bit too loose ligaments in our feet and we get overwhelmed in the myofascia, in the muscles and the fascia. So you go there across and you place your weight. And it shouldn't be too painful. It should be something that feels healthy. You're never overriding the body's signals to you. So be kind and soft, even though the massage might be deep. Okay. So you can do a little test from there, where you come and you forward fold, and you just notice the difference from side to side. That the side you massage might be quite a lot softer than the other one. And then we shift sides. And as I said, I'm standing on my knees so you can see me, so my head doesn't go out of view. But feel free to stand up. I'm rolling over the whole of my foot. So after a while, then leaning on the heel and beginning to go cross fiber. When you find a tender spot, you can lean into it. You can pulse or just stay with a firm, even pressure. If you notice your jaw tensing up or your eyes becoming hard in their gaze, just try to soften. Then you can go over to the back of the heel, front of the heel. And again, finding that tender spots. Okay, good. And do a forward fold again, and just notice how you feel. You might feel a little bit more relaxed in both sides now, hopefully. Beautiful. So let's come and sit. And for sitting now, let's take 2 blocks if you have, or any other cushion. I have the blocks because they are hard and they will give me a better sense of my pelvic bones as I come and sit on my knees. So you sit with the feet on the sides of the block and the sit bones on top of the blocks. And the first thing is to allow your awareness to go inside and just feel your pelvic bones. So we have some landmarks that we want to find with our inner eye, and that is the sit bones, the tailbone. You can also, of course, go in and feel with your hands. And for the sit bones, if you feel that they are uneven, which is very common, you might feel that one is more tucked under, one is wider out, or it's just unevenness there. So you take your hand and you can grab the inside of the sit bone with gentle fingers. So you hold, in a sense, the side of your pelvic floor as it's attaching to the sit bones. And for a little while, just massage that side softly or firmly, in a way that feels good for you, with your fingers. And you might feel already that it feels tense in some areas or not. And from there you widen the sit bone straight out to the side, so you will have a wider base to sit on. And then you take the other side. So leaning away from where you have your hand, you massage with circles. I like to do that, at least, with circles around the sit bone's inner rim, from back to front. Just notice how it feels for you. And then bringing the hand out, the sit bone out to the side. Just notice your base now, if it's different. Maybe your whole spine feels more in line, more symmetrical and supported. Let's take a moment and just close our eyes and focus inwardly, softening the belly and allowing the breath to become even, conscious and easeful through the nose. And just notice if you can relax the belly, if you can relax the sides of your waistline, your spine, shoulders, the front of the neck, back of the neck. Notice if you hold tension around the eyes, the sides of the head, the forehead. How do you feel in your jaw, your mouth, your lips, your tongue? You can soften your face. All the way down inside your mouth to your tongue and your jaw, your throat. Allowing the breastbone to soften in just gently. You can place your hand on your chest and just give your heart a little bit of support. That it's okay that it's resting down and widening back into the back body a bit more. Placing one hand on the belly and guiding your awareness down into the pelvis with the breath, sensing the pelvis. You feel the sit bones pressing, and if you take the hand that's on the front of the belly. You can find the pubic bone. If you slide the fingers down, just give that a little pressure and notice if it's tender or if it just feels okay. You might feel sensitive and vulnerable. So be with any emotions as they arise when we go into this investigation of our body. And just honor the impulses, the remembrance, memories, images and fantasies that might occur when we approach this area of our most intimate home. And bring both hands down now and finding the hip bones on either side. They are just below the belly button now, so you see you can find this protrusion, bony knobs. Just massage them and feel how that feels. And if you follow the rim of the hip bones around the back, you will eventually come to the sacrum and two bony knobs again at the back. So that is your SI joints. And the sacrum is the bone in between the two iliums, the two hip bones. And just give your bum and the sides of your hip a little bit of a squeeze. And rest your hands down. Now see if you can find the perineum. So that is the strong fascial connection. It's in a sense like a tendon in between the sit bones, the anus and the vagina. So find that central tendon of the pelvic floor. And just notice if you can feel your breath pressing down on the inhale, widening the pelvic floor, the whole cylindrical shape of your body. And as you breathe out, if there's a soft springiness, a release out. And some women will feel a lot of movement, some less. And you honor what you feel, honor what you sense. And if there's no movement at all, you just be there with your body and keep breathing. So the more relaxed we can become, the more of this movement can be allowed in the body. I want to show you a way of teaching ourselves to breathe more three-dimensionally. So if we take a strap and you take it around the rib cage, a belt or a scarf also, so you can cross it over and just hold the strap like so. And you continue to breathe like you did before, same breath, but with this tactile support of the belt. And notice that if you're breathing in, is the diaphragm actually widening the rib cage or not? So if we are blocking the diaphragm, the movement of the diaphragm, there will be no movement in this area, and there cannot be any movement in the pelvic floor either. And this is one way of feeling the three-dimensional breath. Many women have been taught to hold our bellies in because of clothing and body image ideas. But by holding this in, often that impairs the movement of the diaphragm and the pelvic floor. So learning to soften the belly is very crucial for pelvic floor health. take away the strap and we will move on to breathing now on our backs. So let's come lying down, and you can have your knees bent and place something on your belly. I will take one of these yoga bolsters that is quite heavy and place it over my belly, and just allowing my body to be restful and heavy to the floor. And when I feel ready, I will begin to breathe with a diaphragm and try to push the belly up into this weight. And then slowly exhaling out. So what this does is that it's, in a sense, is strength training for the diaphragm. And you might feel that the increase of pressure will help the pelvic floor to soften and to follow that movement downward towards your feet with the inhale, and relax softly up and in to neutral with the exhale. And it's a soft movement, a little bit like a jellyfish swimming. Remember to soften the jaw muscles, the tongue and the eyes. The face is restful and soft. Take one last breath with the weight on your belly. And then take away the weight to the side. And see if you can maintain that movement of the pelvic floor as you breathe in. And as you breathe out. Okay, rolling over to one side. And let's come up just to set ourselves for a side lying practice, where you can have a blanket underneath the sides of your ribs and a pillow or blanket for your head. So resting on your side, knees are bent 90 degrees out from the hips. And from there, taking one hand to the lower ribs. And finding that three-dimensional breath here, so the diaphragmatic breath in the lower ribs. And still feeling the movement if it's present in the pelvic floor. So the inhale is a soft stretch and the exhale is a soft release, a relaxation. You can also take your hand and just hold, you cup the whole pelvic floor from the anus to the pubic bone, and you continue to breathe. So you hold the yoni with loving support. and feeling the movement and giving her safety and loving, kind words that she needs to hear in this moment. Or maybe she's also telling you something important about how it feels to relax, how it feels to be touched. Now take the hand up and hold the sit bones instead. And with the inhale, you lift the sit bone up to the ceiling and you exhale and allow it to soften down. So this is stretching the sides of the pelvic floor, and it's a breathing practice. So after a while, the movement might become also a pelvic tilt forwards and back. That will meaning that the pelvis is sliding parallel to the floor, but you continue to softly lift the sit bone as the pelvis moves forwards on the inhale, and as the pelvis returns to neutral, so does the sit bone. So if there's any pain and tension in the pelvic floor, this breathing sequence can be very, very helpful. With your next exhale, you can release and bring the hand in front of you. So I will give some stabilizing movement here for the SI joint while we are still here on the side. So this is called the Clam. It's a very simple movement where you lift the knee up, the foot is still resting on its friend on the floor. So you don't want the pelvis to tilt backwards too much. It's important that the movement is in the hips and the pelvis and the sacrum is stable. You can lift the leg so that it's parallel to the floor and circle the leg. A small circle like you're drawing with a kneecap, a circle in front of you. Shifting the directions of the circles. Now we're working the muscles that are stabilizing the SI joints. That's the first step. Just relax and soften. We can now come up, and I will move so that I can see you on the other side. And I will give you another option here. And that is to take the strap. So instead of you feeling with your hand, for some women this feels very soothing. So you have a long loop in a yoga belt and you place it around the top leg and the top shoulder. So as you come resting down, the belt is actually just giving the pelvic floor a little support. And you can begin breathing in the side ribs again. When you're ready, no rush. Softening the eyes and the lips and the jaw. Eventually come and hold the sit bone. And with the inhale, lifting the sit bone up to the ceiling. Exhale, release. Allowing that movement to gradually become a pelvic tilt forwards and return to neutral. So the hand is lifting the sit bone upwards and the pelvic floor is tilting forwards. There's a soft arch in the lower back and then you return to neutral. And for many women to just rest with this support and just breathe down into it with it is enough to create a sense of deep relaxation in the pelvic floor. But the stretching and the lifting with the hand can, of course, help that a bit more. So let's move on to the clam, the support of the SI joint, which of course is part of the pelvic floor, or the whole pelvis. So you're lifting the sit bone, the knee, and feeling the sit bone dropping down as you do so. So just notice, okay, I'm moving my leg, but I'm actually changing the shape of my whole pelvis as I do so. So having the hand over these bony landmarks and investigating as you move is very helpful. And then lifting the leg up and circling the knee. And we want the leg to be parallel to the floor, so you're not like tilting the leg in an uneven way, because that will affect the pressure in the SI joint negatively and shift directions. And you might notice that you're weaker on one side. It's very common. And that tells you that there's unevenness in the support of your pelvis, which you can do something about. That's good. Just relax. And I like to actually tap with my fist when I've been working this area to send some vibration and some relaxation in. You can go down the IT band from the hip to the knee. Yeah, we forgot to do it on the other side, but now you know. Okay. You can slowly push yourself up. And I will take the strap away for now. So let's take a restorative balasana, so restorative child's pose here. It's also another wonderful way of moving like with the breathing, but into more of a stretch position of the pelvic floor. And if you don't have support like this, the pillows at home, of course you can just do it onto the floor, but this gives you a little bit more height and something to breathe into. I'm also taking one blanket folded over. This will support up to my throat, so not into the throat but just below. And then I take another support, and even though I can easily come down sitting with my butt towards my heels, I will lift myself up and I will place the support between my legs and my pelvis, so that as I come down, it might give me a little bit support to breathe into. So coming, resting down, the head is turned to one side. I like to have my hands underneath the support. And from there, breathing into the whole back body. Belly is pushing down and out. The back is widening with each inhale, and the whole of your body is melting and softening with each exhale. And you stay with your attention in this movement between your sit bones, your tailbone, and your pubic bone. Lifting the head, turning it to the other side. So as you're resting there, making sure that the shoulders are wide, that you really can spread your body out. You're comfortable and restful. And there's no pinching of the neck. The knees are comfortable. The feet are comfortable. Taking one last breath there. And slowly pushing yourself back up to sit. Taking away your supports. It's good if they are close because we might need them. So we're moving on from this more first section that was about creating safety, creating awareness, just being with your body and sensing it and understanding how the breath is moving in your pelvis and where you might be tense or not. So this part now we move into something that is called mobilization. So we want to create movement and still feel our pelvic floor in these individual movements. It's like a deep, wonderful massage to the whole area here. And it's awakening and engaging this the muscular support in a very, very sweet and I find very feminine way. Rather than just doing sit-ups and kind of pushing hard. Yeah, so it's like a smart core practice. So instead of working super hard, we work with the body and we try to find everything from within awakened and engaged and enlivened rather than just pushed into being tense and hard. Okay, so let's begin lying on our backs again. So the feet are hip width and just rest, the hands on the belly. You can take Yoni Mudra if you want. Thumbs and index fingers touching, creating this downward pointed triangle. You find the breath like we practiced just now. And we add movement to the breath. So with an inhale, you tilt the pelvis softly forwards. And with an exhale, you press the whole back softly down as you lift the tailbone up. So in a sense, you're rocking on the sacrum, tilting the tailbone into the floor as you arch the back up, and pressing the spine softly into the floor as the tail is rocking up from the floor. So continuing with that movement and being curious about how it feels in the pelvis, the hips, the whole spine. And finding the connection from the feet, the inner legs to the pelvic floor. So you can engage the legs gently with the movement, pulling the legs towards you, even though they're glued to the floor as you tilt the pelvis up. Pressing the feet into the floor, and you will feel that the pelvis naturally pushes down. Taking a few more of these simple pelvic tilts, feeling the shape of your pelvic floor change as you tilt forwards and back. How as you tilt forwards, the sit bones spread and the back of the pelvic floor widens. And as you tilt the pelvis back, how the sit bones and tailbone come together and the back triangle of the pelvic floor becomes more supported. And find neutral spine, just rest. This next movement is a side movement where you shorten one waist, meaning that you pull your, for example, left hip to the left armpit. The spine is still neutral to the floor. And then you release to neutral and pull the other hip, right hip, up to the armpit. So it's a side bending movement from the side body, between the hips and the rib cage. You will feel that you're contacting some deep back muscles there. You keep that soft movement undulating from side to side, a sideways tilting of the pelvis. Staying curious what happens on either side of your pelvic floor. And release to neutral. You might notice that you have more space in your spine, that you're longer, that you need to take that space out. So next one is a rotation of the pelvis where you lift your right buttocks up from the floor. The left one is pressing down and then releasing back, lifting the left buttock just a few centimeters up from the floor and then releasing it back. So there will be a pressure down into the feet of the side that is lifting, so you can feel that support. Maybe you will feel that side of the pelvic floor becoming more active. You feel the whole pelvis in a sense being skewed, being asymmetrical. This might be uncomfortable if you're sensitive in the SI joints, so be mindful of that. And release to center. Just notice how you feel in this area, from the diaphragm down to your feet especially. Maybe a little bit more awareness, a little bit more warmth, relaxation and spaciousness. Now begin to circle the pelvis. You combine, in a sense, these 3 different movements you just did. So a little belly dance on the floor. So the pelvis is tilting forwards and rolling over from side to side, pressing into the floor and rolling over from side to side. And you can allow your awareness to, for example, be placed in the tailbone and creating the circle from the tailbone. Feel how that feels. And switching directions. You can try to create the circle from the top of the sacrum. And feel how that changes the movement quality a bit. And relax at the center. Take a deep in breath, just filling up the whole pelvic bowl, the side of your body, and soften. Place the arms next to your body, palms facing up. So let's do some spinal malas. It's like a prayer bead spinal roll up to Setu Bandhasana, to bridge. You lift your tailbone and slowly press the spine into the floor before you start to lift. Vertebra by vertebra, slowly lifting up. And you roll as high up the spine as you feel comfortable. And then you begin rolling down from the upper spine, down the spine towards the sacrum and tailbone. And allow the movement to be slow. You don't have to match it with your breath. But you are curious about what parts of your spine are yielding and soft, and what parts are more stagnant, stiff and cold. Pressing evenly with the feet into the floor. And gradually release down and soften. If you press your right foot now into the floor, and with an exhale, see if you can activate the pelvic floor. And inhale and release. With an exhale, press your left leg into the floor and try to lift the pelvic floor gently up and in. And release. And continue to alternate legs like that. And you might notice that the leg activation is actually helping you to find an engagement on that side of the pelvic floor. You might even lift the toes on that side as you press down, and that might give you even more. And now let's take something in between our legs. So that can be a block or a pillow. And you hug the support in between the legs. And with an exhale, just lift the toes, hug the block, and see if you can have a sense of the whole yoni, the whole pelvic floor lifting up and in. And there will be a firming of the low belly as well. And with an inhale, you just soften everything. So exhale, you begin lifting the toes, hugging the blocks, pulling the perineum and maybe the inside of your vagina up and in. The low belly might engage together with all of that. And then you soften. So once more on exhale. And then you can try to do this on the inhale, meaning that you actually activate even though there's a downward pressure. So that will give you a little bit more need to be strong in the pelvic floor. So that even though the diaphragm is moving down, the pelvic floor is staying supported and lifted against that pressure. For some it's easier to do that, for some it's more difficult. So just be curious and kind to your body and what you experience. And take one more inhale like that. And then relax, take the support away. Place the arms next to your body again. And inhale, slowly roll up to the bridge once more. You don't have to go so high. And when you're lifted there, do some of these pelvic tilts back and forwards, keeping the sacrum lifted from the floor. So whole pelvis is floating in the air as you're tilting back and forwards. And find something that feels neutral and begin to do the pelvic lateral sideways tilting, where you pull one waistline up towards the same armpit side. And find center, and then rotate the pelvis. So one side here is lifting to the ceiling, the other one is dropping down to the floor. You do that a few times. This should not cause any pain in any of the pelvic joints or the low back. Then the practice might not be for you today. Now I'm starting to circling my hips, still keeping them lifted from the floor. And shifting directions. Good, and slowly release down and rest. You can bring the knees in towards each other and heels out, and take a deep in-breath into the belly. And relax. Feeling the aliveness, the vibration and pulsation, warmth spreading through your pelvis and low back. Stretching the arms out at 90 degrees, so from the shoulders and out. Let's begin with some simple rotations for the spine here. You can widen your feet so they are mat width apart. And allowing them now to fall over slowly to one side as you look the other way. And bringing the knees slowly up and over to the other side, rotating the head. So beginning with the simple rotations. So often we focus on the areas of stretch when we do these things, but for now, feel your pelvic bones. How the shape of your pelvis is shifted, is skewed as you move. So often we can have an idea that the pelvis is so stable and that it's a structure that is very unyielding and hard. But if you move here, you will really feel that there's actually it's shifting its shape as you move. I'll give you an option here for another practice, which is as when you come over to one side now, you can bring the top leg over and shoot the foot out parallel to the floor, keep it in the air, and then to come back, you lift the foot up to the ceiling and allow the pelvis and the other leg to follow. You bend the knee, placing the foot on the floor, rolling over to the side, and press out through the leg as you look in the opposite direction. Then lifting the foot straight up to the ceiling, and via the tensegrity of the body, everything is coming back to center. Placing the foot down and shifting sides. It's very nice if you can rotate the head to the opposite side of the foot. Releasing the jaw and the eyes soft. Do one more. And find center, take some deeper breaths. Notice how you feel now when we've included more of the lateral body. I will take a blanket now underneath my sacrum, just for some padding. So this next is a release practice where we just softly bounce the pelvis up and down. So we lift and release, and really shake out any tension that might be in the pelvic floor, in the whole pelvic area, in the hips. And of course, you can add your voice. So the jaw, the tongue, and your vocal cords are of course connected, as we've explored, to the pelvic floor. So important to allow all of that also to release tension here. And come to stillness. You can stretch the legs out, just rest for a moment. And be curious if anything has changed, and in what way. If you feel with your hands that you would like to offer some loving touch anywhere on your body, it can be your legs, your pelvic area, your belly, your breasts, your face, anywhere. So just offering that comforting, loving touch. And see if you have a message from your body in this moment. So often when we do these intimate practices, you might learn things or remember things. So for a little while, just be open and receptive to your experience, to what has moved within you. And allowing the hands, your touch, to be there for you, soothing and loving if needed. And see if you have any words of kindness, of understanding, that you would like to offer to your body in this moment. And from there you can begin to wake up with movements of the hands and the feet, like some water creatures awakening, and feeling your contact to the floor. You can press down, feel that you're alive against the floor, stretch and move. This full body yawning, like it's such a beautiful way to release the whole nervous system, fascial system. So, simple way to self-soothe. And I invite you to gradually come up